I've been performing cosmetic procedures for 23 years. We have the whole gamut. We offer the whole gamut from temporary to permanent fillers, fat as a filler as well. We often use hyaluronic acid fillers. It's a temporary filler. There's multiple brands, Juvederm, Perlane, Restylane. There's lots of different brands of that. That's very common for us to use. We also use Radiesse, which is a different type of filler than hyaluronic acid. We also have Bellafill, the more permanent filler, and Sculptra, which is kind of a collagen growing filler, along with the fat transfer, often done during liposuction. There's a lot of really nice areas on the face that, with time, the fat contours on your face diminish, and there's a certain aging process that happens. So when you pass 40, your cheek fat from here to here actually just diminishes, and your skin approaches your muscle, and you become more skeletal appearing. To bring back that softness and kind of a happy look, because a rounded cheek is associated with someone who's happy. You just put filler back in there. It looks just like the fat used to look, and is a very subtle but a very attractive look on people. People, I think, because it looks happy, are more attractive when they do it. You know, people know that these lines, any kind of shadowing from overhead lighting, can look a little sinister. So so it just brightens it up when you bring it into the light, and it looks always very natural. There are the lines up in the forehead. We call this the glabella. So these glabellar frown lines are very easy to get rid of and make people look way more approachable really fast. So, and that's a quick and easy procedure. And sometimes they need maintenance, but a lot of times they're very long lasting, especially if we use a permanent filler. The pros of having a temporary filler are you can try it on. We can also take it out sometimes. If it's a hyaluronic acid filler, we have an enzyme that will eat it up. So you can try it on for size and with no risk, really. They are pretty long lasting, and they last from anywhere from usually around 8 to 10 to 12 months. Cons are you have to pay for them. There's always a possibility of bruising. However, I have perfected over the years methods of really decreasing bruising and pain during the injection. So I will often use nerve blocks, especially around the lips, so people don't feel what I'm doing. We use ice a lot. And I actually will add to the filler extra lidocaine, which is a numbing agent, and a little epinephrine. And the epinephrine causes vasoconstriction, which is the little vessels get small, so you're much less likely to bruise from the procedure, which is really one of the bigger downfalls is the bruising. And so we've really minimized that in the recent years with that additive. The permanent filler called Bellafill is a wonderful filler. However, the con is that you have to get skin tested to it a month ahead of time. So that one takes planning ahead. The Radiesse is a wonderful filler as well. And a lot of, like Radiesse and the hyaluronic acid, sometimes it actually will stimulate collagen formation. So you have a long-term effect as well. A fat transfer is where we take your own fat and immediately transfer it into your cheeks or lips, and it is natural, obviously, it's your own fat. You can't have any kind of rejection or anything like that. And it is long-term because it also transfers some of the stem cells with it that make fat. And it works best in younger people. I would say younger as in less than 40. the website, I have a lot of pictures before and after. A lot of them are immediately after, so you know what you kind of look like right away, which is really helpful because people are worried they're going to have downtime. And really, with the next day, they usually look just fine. It does look best after fillers. After 3 days looks good, 5 days even better. But the website has lots of before and after pictures for that. Patient will come in. I'm hoping they have avoided blood thinners. That is aspirin and ibuprofen and drinking alcohol for a couple days ahead of time. If they can't avoid being on medical blood thinners, we can still do it, but the chance of bruising is higher. They usually talk with me about what's bothering them, and I will tell them a realistic goal of what I can improve with fillers. We'll draw actually on your face when we do it, and then we recline you. I will numb up with a nerve block if we're doing around the mouth. Otherwise, we use ice, and there's numbing in the filler that I add extra along with a little epinephrine to decrease the bruising. And it's really not very painful at all. It's the ice and the numbing really make it pretty comfortable for a procedure. And it's very quick. It can take less than 30 minutes. The hyaluronic acid and the Radiesse fillers, they usually look fine the next day, but they look pretty good at 3 days, and even their best at 5 days. They just get smoother and more natural looking over that time. The Bellafill, which is the permanent filler, goes through its own very different path in that you put it in and it has a fill because you can see right away what's going on. The permanent part of the filler is actually these microscopic little beads that you can't see, but they're floating in collagen. And the collagen actually goes away over about 3 months, leaving the beads behind. And then your body will make collagen around each of those beads. And that takes about the 3 to 4 months. So you'll have fill, it'll go away, and then it'll fill again with your own collagen. So that's kind of a process. Sculptra, you put in, and it takes 6 weeks to 6 months to see the final effect, and it grows collagen after we put it in. Then that lasts, several years once we do that. Fat, when we transfer fat, you look a little swollen for about 3 days, but then it looks pretty good, and so most people look fine after 3 to 5 days after fat transfer. The fillers are about $600 for the volume that is about a small sugar cube. That's one syringe. And depending on the defect that we're filling and the look that we're looking for, it may take several syringes or just one syringe. This area would take no more than one syringe, but to do all this area may take up to 4 syringes. To prepare for filler consultation, we often will do it at the same day that you have your consult. We usually keep time for that, but that's not necessary to do it the same day. It would be nice if you could avoid alcohol for a couple days ahead of time. Aspirin, ibuprofen, and any, if you're on medical blood thinners, then if it's okay with your doctor to go off those, or we can still do the procedure while you're on it, however the bruising may be more. Northwest Face, the doctors at Northwest Face and the providers here are really focused on quality. We have more experience, I think, than you'll find most anywhere. We're an amazing team that works well together, and we're extremely focused on patient outcomes and safety. So I think that that makes us somewhat unique, in that we are very concerned with the outcomes and patient satisfaction, and only offer things that actually work.